So again, a very good afternoon. So I'll be presenting a morphometric analysis of primary congenital aphakia using a high resolution anterior segment OCT. Do not have any financial disclosure. So we all know congenital primary aphakia is one of the, again, a rare anterior segment pan-ocular abnormality. It has a single gene, that is a FOXC3 mutation, and in South India where consanguinity is very prevalent, and they can have a plethora of ophthalmic complications. They do have a CNS complication. It is beyond the relevance of this particular talk. And congenital aphakia, when we look at the entire anterior segment is disorganized, you have something called a silvery corneal opacification. So it may sometimes look like a sclerocornea, extreme microphthalmos, sometimes even look like a congenital staphyloma. And one of the diagnostic tools is we have to do an UBM to rule out presence of a lens. If the lens is absent, so the lens plays an important role during the embryogenesis. Many a time when we examine these children, if we do not have an access to UBM and anesthesia facility, we end up missing. So one is a good clinical evaluation combined with the corroborative UBM, and also the genetic screening is the mainstay of diagnosing this particular entity. Why do we need to diagnose this entity? Because most transplantation or any penetrating procedures have abysmally poor outcomes. So what we did is prospectively, can we consistently able to diagnose any other non-invasive modality? So any child, you can walk in, you can have something called a flying baby technique, where you can easily grab a necessity OCT. And if you look at, this is a normal healthy eye in a high resolution, you can see all the layers. You have a beautiful architecture, except DUA, I'm able to, figure out, point out, and right from epithelium, Bowman's membrane, entire anterior segment, in the corneal architecture, including the Descemet's endothelium. Whereas the second picture, if you carefully look at, you don't have that very distinct architecture. It is completely disorganized. Cornea is not only thin, a very aberrant architecture, and you have a lot of potential spaces that indicate the corneal vascularization. It doesn't have a healthy Bowman's, doesn't have a healthy endothelial, Descemet's endothelial complex. So that's what the premise of study. By just doing a simple OCT, we'll be able to diagnose. So now, having seen several hundred cases, by the look of this cornea, that is a typical silvery corneal appearance, I know we are dealing with a congenital aphakia, and no invasive surgeries in such cases. I skip in the interest of the time. And what we did, included about 11 eyes here, and consistently we were able to plot on a OCT, which is a quite diagnostic. So the message is here, not only there is a global thinning, and entire anterior, central, and a posterior architecture is distorted here. Meaning, OCT can consistently able to tell us this particular entity is a congenital aphakia. This is the results, and this highlights the value of AIOS even in a babies with a congenital corneal abnormality. And these cases we can promptly put them on a aphakic glasses. They tend to improve, have some ambulatory vision, and no invasive surgery when you make such a diagnosis. Thank you.
Thank you, Murali. In the interest of time, we won't
Yes.